As we get older, protecting our hearts becomes more important than ever. But what if the biggest danger isn't your diet, your stress, or even your genetics? What if it's sitting quietly in your medicine cabinet? Today, leading cardiologists are sounding the alarm, not about rare diseases or complex surgeries, but about common pills many older adults take every single day, often without realizing the risk. We're talking about medications that are FDA approved, doctor prescribed, and widely used, but in aging bodies they can quietly increase the risk of heart failure, stroke, or sudden cardiac events. And the worst part, most seniors are never warned. Prescriptions get renewed automatically. Side effects are mistaken for just aging. Dangerous drug combinations are often overlooked. But that changes today. In this video, we're counting down 5 pills that can damage the hearts of older adults, especially after the age of 60. Some of these will sound familiar. Others may surprise you, but every single one deserves a second look. This isn't about fear, it's about facts, backed by research, trusted by experts, and explained in plain English. If you're over 60 or care about someone who is, pay close attention. What you're about to learn could protect your heart, your independence, and maybe even your life. Let's begin with number 5. Pill. Number 5. Ibuprofen and NSAIDs. The hidden strain on aging hearts. Ibuprofen, naproxen, diclofenac. These painkillers are in nearly every home. They're familiar, trusted, and easy to find. When pain flares up from arthritis, back stiffness, or headaches, most people take one without a second thought. But after age 60, these common pills can quietly become a serious risk to your heart. NSAIDs and nonsteroidal anti-inflammatory drugs do more than relieve pain. They also affect how your kidneys manage salt and water. In younger adults, the body usually adapts, but as we age, kidney function naturally declines even when lab tests appear normal. That decline can cause fluid retention. You may notice swollen ankles, tighter shoes, or a heavy feeling in your legs. You may feel more tired by the end of the day. These symptoms are often blamed on aging, but they're warning signs. Extra fluid increases the workload on the heart. For older adults, especially those with high blood pressure or heart disease, that added strain can worsen heart failure or trigger dangerous blood pressure changes. NSAIDs also reduce blood flow to the kidneys, increasing the risk of kidney damage, high blood pressure, heart attack, and stroke. Even short-term use can be risky, especially when combined with diuretics or ACE inhibitors, a dangerous combination that can severely impair kidney function. The most dangerous part, you don't feel it happening. If you're over 60 and taking NSAIDs regularly, talk to your doctor. You may not need to stop completely, but limiting use or switching to safer alternatives like acetaminophen, topical treatments, physical therapy, heat, or stretching can protect your heart and kidneys. Pill number 4. Benzodiazepines, the sleep aid that can steal your stability. Medications like lorazepam, temazepam, and diazepam are often prescribed for sleep or anxiety. For many older adults, they feel like a lifeline, helping calm the mind and bring rest. But these drugs work by slowing the brain and nervous system. In older adults, that effect can go too far. Benzodiazepines slow reaction time, weaken muscle control, and impair balance. This greatly increases the risk of falls, especially at night. And falls are one of the leading causes of injury, hospitalization, and loss of independence in seniors. Long-term use is also linked to memory problems, mental fog, dependence, and a higher risk of dementia. Stopping suddenly can cause withdrawal symptoms like anxiety, insomnia, tremors, and agitation. That's why it's critical not to stop these medications abruptly. If you're taking a benzodiazepine, speak with your doctor about safer alternatives or a gradual taper. Non-drug options like cognitive behavioral therapy for insomnia, mindfulness, breathing exercises, and gentle physical activity can be just as effective, without the same risks. Pill. No. 3. Proton pump inhibitors, PPIs, the silent drain on your body. Omeprazole, pantoprazole, esomeprazole. Proton pump inhibitors are commonly used for heartburn and acid reflux. They reduce stomach acid and offer quick relief, but these medications were never intended for long-term use, especially in older adults. Stomach acid helps absorb essential nutrients like calcium, magnesium, iron, and vitamin B12. Long-term acid suppression can lead to weak bones, fractures, anemia, muscle cramps, fatigue, heart rhythm issues, and cognitive changes. PPIs can also weaken immune defenses and increase the risk of infections like Clostridioides difficile, especially in seniors. Some studies link long-term use to kidney disease, dementia, and cardiovascular risk. If you've been taking a PPI for months or years, it's time to reassess. Many people can reduce the dose, switch to intermittent use, or stop safely under medical supervision. Pill. Number 2. Heart and blood pressure medications. When the cure becomes the risk. Heart and blood pressure medications save lives. But in older adults, doses and combinations must be carefully monitored. Diuretics can cause dehydration, electrolyte imbalance, dizziness, and falls. Calcium channel blockers may cause leg swelling, fatigue, or slow heart rate. Beta blockers can reduce exercise tolerance, cause cold extremities, and mask low blood sugar. As the body ages, kidney function slows, blood vessels stiffen, and drug metabolism changes. A dose that worked at 55 may be too strong at 75. When multiple heart medications are combined, the risk increases. This leads to medication overload, fatigue, weakness, confusion, and balance problems, often mistaken for aging. Regular medication reviews are essential. Pill number 1, polypharmacy. The most dangerous pill is all of them. Polypharmacy, taking 5 or more medications daily, is one of the biggest hidden threats to senior health. Nearly half of adults over 65 take 5 or more medications every day. Many take far more. Each additional pill increases the risk of side effects and dangerous interactions. The effects are subtle: fatigue, brain fog, unsteadiness, mood changes, digestive problems. Often medications prescribed years ago are no longer needed, but never stopped. The solution isn't stopping everything, it's reviewing everything. A proper medication review can reduce unnecessary drugs, restore energy, improve balance, sharpen thinking, and reduce hospital visits. Sometimes better health isn't about adding more. It's about letting go. Final message. If you or someone you love is taking 5 or more medications, don't wait. Ask for a medication review. Ask the hard questions, because the most dangerous pill might be the one you didn't realize you were still taking. If you found this video helpful, like and subscribe Fresh Vitals for more evidence-based health content every week. And in the comments, tell us, how many medications are you or a loved one currently taking? Your story might help someone else more than you know.